Hello, my name is Cynthia Thomson. I'm a professor in health promotion sciences at the Mel and Enid Zuckerman College of Public Health at the University of Arizona. I'm here today to talk to you about cancer transitions, living well through healthy lifestyle, skills, and habits. The overview of today's presentation is that we're first going to review common lifestyle-related risk factors for colorectal cancer, including early onset disease. We're then going to share the 2020 American Cancer Society guidelines for diet, nutrition, and physical activity, and how these inform on both cancer prevention and survivorship. We're going to explain key behavioral constructs and factors that drive behavior change. And we're going to discuss specific strategies to enhance health through improvements in lifestyle skills and habits. Knowledge alone will not result in behavior change, but without knowledge, health behaviors are unlikely to change. This is step one. So I want to take a few minutes to lay some founding information to help you understand why it's important to change your health behaviors in order to have a higher quality of life after a colorectal cancer diagnosis. The exposome is the totality of human exposures that can contribute to colorectal cancer. These may be general external factors such as our socioeconomic status, our education level, the amount of stress we're under, or even our social capital. Our internal environment, things like metabolic factors and hormones and the gut microbiome, inflammation and oxidative stress, all inform on our overall body functions that contribute to colorectal cancer risk. Most of today, we're going to talk about specific external factors, many of which are under our control, that can drive colorectal cancer survivorship. Radiation infections can definitely cause issues with colorectal cancer, but there are a number of behavioral factors that can also be important to think about, such as tobacco use, alcohol intake, physical activity, and diet. And we want to think about the fact that at various points in our lives, we may have had different levels of exposures to these behaviors. But regardless, even if we are aging as we go, we do still have the opportunity to improve health outcomes as we age and reduce the risk of colorectal cancer recurrence and to improve our quality of life by modifying these behaviors. Importantly, cancer is a disease of obesity. We know that there are now 14 cancers associated with obesity, and that for people who have been diagnosed with colon and rectum cancer, about 30% of those diagnoses would have been associated with obesity. So it's important to think about obesity as we try to improve our health. Obesity is associated with cancer progression. We know that obesity is associated with systemic metabolism, including increases in glucose, insulin-like growth factors, and triglycerides. Obesity is also associated with inflammation. It causes an increase in cytokine production. It also is associated with cellular growth, and that's not something that we want to key in on when we have cancer cells. And lastly, obesity can drive angiogenesis, or the formation of blood vessels that can contribute to the metastasis of cancer cells. Now, it's important to know that obesity is associated with a metabolically unhealthy phenotype. So this is an individual who is suffering from key drivers that may affect their colorectal cancer risk. For example, an increased waist circumference, high triglyceride levels, high fasting glucose levels, high density lipoprotein levels, and even high blood pressure. 1 in 3 Americans suffers from at least one of these factors. Metabolic phenotype is associated with colorectal cancer risk. And it can happen even in individuals of normal weight. So it's not just about what your weight is or your body mass index. It's about your metabolic health. Normal weight individuals who are very inactive or have extensive sitting time or low quality diets have been shown to have higher risk of colorectal cancer. In one study of 5,000 postmenopausal women who had normal body mass index, we found that 34% of those women were metabolically unhealthy, and that being metabolically unhealthy was associated with an almost 50% higher risk of colorectal cancer, and also increased the risk of colorectal cancer mortality. A major driver of this risk was elevated fasting glucose levels and low high-density lipoprotein. In the end, the take-home message is body mass index alone does not predict metabolic risk. You need to talk with your doctor and find out what are your risk factors, what is your metabolic health, so that you can begin to work towards improving your metabolic health should that be necessary. So body composition is another important thing we want to think about. Beyond our body mass index, our bodies have certain levels of fat tissue or adiposity, muscle mass, which has been shown, if low, to be called sarcopenia, and these body composition measures have been associated with our immune response. All of these factors can lower survival after colorectal cancer. So another thing you can do to promote your well-being is to have your body fat, lean mass, and visceral fat measured by DEXA or abdominal CT. It's important that we do our best to achieve and maintain a healthy body weight. Make sure that we're paying attention to energy in and energy out, but also think about what are the behavioral factors that are driving our intake, our inactivity, as well as our risk for obesity overall. Think about not just your diet and activity, but what about your sleep patterns, your stress level? Importantly, with diet, read those labels. Find out where your calories are coming from. Build activity into everyday life and monitor those health behaviors. Small reductions in body weight can drive metabolic health. You don't necessarily need to get to the ideal body weight. What you can do is lose 5 to 10% of your body weight and have dramatic improvements in your metabolic health. Tobacco is another behavior that drives colorectal cancer risk. Tobacco is associated with between 10 and 39% of colorectal cancers, and its higher association is with rectal cancer. We also see sex differences where males have 39% higher risk for left-sided colorectal cancer, where females have a 20% higher risk. So tobacco use in males is particularly problematic. We also want to make sure that we think about the survival implications of tobacco. Never smokers versus current smokers have a 20% lower risk of disease coming back. So stopping smoking after colorectal cancer, if you are a smoker, is so important. Importantly, there's limited data on the effect of secondhand smoke exposure or even vaping on survival after colorectal cancer. We would estimate that these are probably not protective in any way and probably do reduce survival, but we don't have the information yet. What should you do? If you smoke, seek support to stop. Almost every state in this nation has quit lines that can help you for low or no cost. Cancer centers also have support services for tobacco cessation and even tobacco cessation specialists who can help you in your journey. You can also consider nicotine replacement therapy as another strategy to help increase your risk or your possibility of quitting smoking. If you are exposed to secondhand smoke, make small steps to reduce your exposure. There's also evidence that alcohol drives cancer risk, including colorectal cancer risk. For colorectal cancer, it is estimated that 2 or more drinks per day are what drives an elevation in risk that seems to account for almost 13% of colorectal cancers. Alcohol is also associated with early onset colorectal cancer. This is true of beer in relation to rectal cancer, but almost every drink with early onset disease. Alcohol is also associated with higher colorectal cancer risk in individuals with the high-risk Lynch syndrome. Data on the role of alcohol after diagnosis is a little more inconsistent, but we can estimate that those 2 drinks or more a day is really a problematic cut point, and we need to certainly stay below that. Remember that alcohol is a carcinogen, and so it's important to try and avoid it if at all possible. The take-home message is avoid or limit intake. Track what you're doing, especially the portion sizes, to make sure that you're not over-consuming. Alcohol is also a major source of calories with minimal nutritional value. Understand that mixed drinks can contribute significant amounts of added sugar and calories with all those additives that we put in. And alcohol can contribute to liver toxicity that may affect chemotherapy tolerance or clearance.